Welcome to Reporter's Notebook with Howard Castay, owner of KBZE 105.9 FM.
It's Howard Castay, General Manager of KBZE Radio. With me is Miss Stephanie Guidry, the CEO of Franklin Foundation Hospital, and she's got some big news.
Thank you, Howard. We have some really exciting news. I don't know if you're aware, but we are building a wellness center. And because we are building a wellness center and we're getting bigger and we're bringing new specialties and new services to Hospital District Number 1 or our service district, we have decided to rebrand our hospital and our wellness center with a new name. And our new name will be Bayou Bend Health System. And the reason we went with Bayou Bend is because there are 3 bends of Bayou Teche. One is in Sheraton, one is Irish Bend, and then there's a bend in Franklin. And so we went with geographical naming because the importance of the bayou to the community, both from industry and from quality living and living around water and all the activities that go along with that. So we're really, really excited about the new name, and we're moving forward with looking at a new logo as well as some new colors to go along with it.
You know, this corner is a bevy of activity. Before, when you drive down Northwest Boulevard, you just see the hospital. Now you see buildings, construction. I mean, it's just incredible. The wellness, of course. Remind everybody about what's inside of the wellness center.
Well, the biggest piece of the wellness center is a fitness center that everyone can be a member of. It has 2 swimming pools, a lap pool, exercise therapy pool, state-of-the-art exercise equipment that connects to your smartphone and tracks everything you do and can be conveyed to your physician or to your physical therapist or whoever needs to have that information. Along with that, we're moving Ortho LA into that building, Dr. Brent Rochon, cardiologist, into the building, and we're adding 2 new services. We're adding cardiopulmonary rehab and senior behavioral health. The other thing we're moving over there is our physical therapy department, all of our outpatient physical therapy, both OT, speech, and physical therapy. So it's going to be a place of gathering, a place of fun, a place of wellness. We're trying to shift from taking care of the sick to making sure that everybody is well and getting healthier.
Why do you feel that's important?
Well, I think that, to be healthy, it's not just body, it's body, mind, and soul, and it's a community, and we all take care of one another at one point or another. And so, if we can be healthier, then we don't end up in the hospital. Now, that's a double-edged sword because we're here, for the hospital to be financially sound, but we can do that with outpatient services. We don't have to do that with inpatient services necessarily. But we want to be here for all the healthcare needs that make sense for our hospital and for our community.
Now, there's also going to be a couple of meeting rooms or available venue rooms?
Yes, there's a beautiful convention center our conference center that we will be renting out for all kinds of events. It could be wedding receptions, weddings, proms, Mardi Gras balls, has a full catering kitchen. And I also didn't mention that for the fitness center, we will have child care for the mamas and daddies that want to come and exercise. It'll have like a 2-hour time limit. And then we also have a wellness center for lab work and biometrics and some other things. So, and then the bistro. It's a beautiful bistro. It's going to have smoothies and coffee and healthy lunch options. And we're hoping people will come there to get a cup of coffee, to visit with friends, and have a good time.
Everybody loves the restaurant here, so it's going to be enticing to see it, I guess, in a bigger area, right?
Correct. Yeah, it's going to be beautiful. And the inside of this building is going to be so pretty. It's warm tones, wood tones, ceramic tile, beautiful colors. It's not going to look sterile. It's going to be very homey and very inviting.
Now, a couple of months ago, you or the hospital signed an agreement with Thibodeau Regional. Remind everyone about what that agreement is about.
So it's a specialty physician agreement, and what we have done is we've asked Thibodeau to send specific specialty physicians to us 1 day a week So right now we have Dr. Newport, who is neurology. We have Dr. Arias, who is medical oncology, and we have Dr. Haight, who is pain management.
Okay, and we're now kind of back in a COVID alert a little bit. So have you all changed your policies again here at the hospital?
Unfortunately, we have. We've gone back to masking in all areas of where there are patients and visitors. We're hoping that won't last long, but as everyone knows, the COVID numbers are going up. So on the side of caution, we've gone back to masking.
Okay, well, let's go back to the Wellness Center. Will anyone be able to join from any area?
Yes, it's not limited. It is a membership. It will be very reasonable. We should be sharing the monthly membership fees shortly, but we want it to be as reasonable as possible so as many people as possible can be members. Construction should be complete in January, and we're hoping to have a soft opening around the 1st of March, or somewhere between March 1st and mid-March.
And that's going to be for everything in the Wellness Center?
Yes,
Wow,
yes,
incredible.
yes. We're so excited. It is absolutely gorgeous.
Well, I just want to compliment you because changing a name that's been around for a long time is quite a task, but you've managed to get a name that encompasses the culture of the area. Why is culture so important to you when operating this hospital?
Well, because we have a unique culture. We are Southern Louisiana. We have beautiful people, wonderful food. And I think that it's important that this hospital embrace all the great things about South Louisiana, and specifically this area and our service district. I'm really excited about the name. We went with a company that helped us develop the name. We had a focus group of hospital employees and community members. We had several meetings. We went through several renditions of different names. It was narrowed down to 5 names, and then there were 39 polls sent out, there were 39 focus members. It was a good complement of the community and the hospital. And overwhelmingly, the 70% response rate, which is an outstanding response rate when you're talking about surveys or polls, the winner overwhelmingly was Bayou Bend Health System.
That's great. So there you have it, folks. Franklin Foundation changing its name to Bayou Bend Health System. Stephanie, I just want to let you know this name change certainly doesn't take away from the decades that Franklin Foundation has been serving this area. I think it's to let people know that this isn't just your local hospital anymore, but it is quickly gaining ground as being a beacon of light in healthcare along the Gulf Coast, along Highway 90.